the real question becomes, is when we do have these problems, especially tumors, which Albert and I take care of, is how do we fix it? Because I think fundamentally, we're torn between two different pressures. One is we want to get that tumor out, because fundamentally, the more tumor we take out, the better the person's prognosis is. But on the other side, one of the problems is that if we take out too much and we take out important areas of brain, we compromise function.
There's a lot of diversity in what our brains do and the problems that our brain faces. We need tools to confront this diversity. So we have tools for every occasion. And the first tool I want to talk about is something called Intraoperative MRI, and that's something that Washington University and Barnes-Jewish Hospital has, and there are very few of them around the world. Let me first show you a world without intraoperative MRI. And let's say we have a gentleman, 50 years old, who has a brain tumor in Broca's area. He can't speak very well, and we bring him to the operating room. And we take out what we think is most of the tumor using cutting-edge, state-of-the-art microscopes. Okay, but we don't know that we left this little part there in the front. So he goes to the ICU, he does well, and then he heads to the floor the next day where he finally obtains his post-operative MRI. And only then do we see that we missed something. So now we have to go all through this again. It's like Groundhog Day. It's highly inefficient. Wouldn't it be great, for instance, if we could find out that we missed some of that tumor while we were in the operating room? And so we have this intraoperative MRI at Washington University, and this is a video of it. It doesn't move this fast. But we can do an operation, keep the patient sterile, have the intraoperative MRI come into the operating room, and then we can see how we did. And so you can imagine this saves a lot of time, a lot of suffering for many patients, and we can really get out as much as we safely can. And we can confirm that, just as it's showing. So I'll just give you an example of a patient I had last year, a 51-year-old female who had a tumor in her right parietal area. And that's this part of the brain right there. And so I took her to the operating room with the intraoperative MRI, and I did what we thought was a pretty good job. And then looking through the various slices, we find that there's a little bit of tumor left. And I could not see that with my eyes, nor with a microscope. And so we could go back into the operating room in the same episode and take out that little part of the tumor. And she's doing great.